Type we'll start after 1 minute, sir. 2 minutes. Yeah. 2 minutes. ठीक है, इधर लाइव वाला पॉज कर लो, मैं आवाज दूंगा। ठीक है, आता यू कैन स्टार्ट। हेलो,
Hello everyone present here. Hello everyone, I am Ashwini here and I welcome you all for today's session, which is titled as Photography in Dentistry. And presenting this session, we have with us today's expert, Dr. Hiroj Bagde, sir. Dr. Hiroj Siddharth Bagde, sir, has completed his master's in dental surgery, Department of Periodontology in the year of 2014. He has completed his MBA in Hospital Management and Clinical Research from Symbiosis University, India. He has completed PhD in Dental Science in year 2018. He is currently a faculty as an associate professor in Estimated Dental College. He is the recipient of Honorary Best Academician, Best Dental Photographer, and Best Tutor in various awards. So do not waste further time. I would like to invite Dr. Hiroj Bagde, sir. Hello.
Hello. Am I audible there?
Yes, sir. You can start now.
Yeah. Thank you very much for the warm welcome. I'd like to welcome all the participants. Good morning, good evening, from which various parts of the earth. So I'll be covering a very important topic for the professionals who are dental surgeons, budding dental surgeons, for the postgraduates, and the faculty members. Photography just for me is a long journey, which I have undergone through many years now. So that's why I've given my slide to start off with as a statutory warning, which tells that I do not endorse any company here, but since 8 years I'm practicing with Nikon. So that's why all the pics which have been taken are from my own self, and they're watermarked. And this is not a compilation, but it's a long journey of my experience in the art of photography. That's why many of them call it as a macro photography, but I term it as macro dental photography. So it is a part of macro photography, which is evolving now in the later stages to involve the various aspects of dentistry inside it. Now, to begin with, what is this art? Now, I call it as an art because dental photography as a term now has evolved as a branch from macro photography. That's why macro has been added there. Now, many of them huge lenses, huge cameras. These all things will be incorporated, but I have kept 3 fundamentals here. First would be the light, second would be the lens, and third would be the camera. Now, why I have taken these things in this order, I will tell you first that because all the game here played is because of the lights which are being evolving nowadays. Second comes the lens which has been used during macro photography. Obviously, it will be a macro lens. I'll be demonstrating, I'll be sharing you all the different kinds of lenses which are available. And third, and the lowermost priority goes for the camera. Nowadays, evolving for mobile macro also is there. We have DSLRs, we have SLRs, we have point and shoot cameras. I'll go through each one of them. Now, first of all, everybody knows what a DSLR is nowadays. It's very common. Every household will have this. But the problem is, why to carry such a big device for a simple purpose of recording a case? Now, why we are recording a case? It's not just for medical legal purposes, but we need to identify and we need to rectify the mistakes which we have done by these macro lenses. Because why we are opting for macro lenses? Because they give us the reproduction of the image as it is. Means we are not having any magnification. We are having the ratio as 1:1. Means whatever the image is seen, we are going to evolve through the image the same ratio. Now, I am having one DSLR with me, the same as shown in the picture. So the basic is about how this thing works. We have what we call as a dial. We have a dial which will assist us and provide us different kinds of functions which are available inside the camera. Then we have the shutter click here. Then we have one thing which is called as the hot shoe here. And the last one is the screen, which we are going to see what the screen tells us about. Now, we have various cameras. Among them, I have been practicing through mobiles, I have been practicing from point and shoots, I have been practicing through normal DSLR, high-end DSLRs. Now, why they are different? Why we need to go for only dedicated DSLR thing, that the mobiles nowadays are proving to be as close as to the DSLRs, but the problem is I cannot totally rely on a mobile to get a very good 1:1 ratio. 1:1 ratio means what the image is, what the image size is, and what the object size is, the same ratio. We cannot reproduce through mobiles. That's why we have some advantages and disadvantages. And one more thing is that we have a point and shoot in between the two mobiles and a DSLR. We have a point and shoot camera. Now, what does the point and shoot and a DSLR differ is that the DSLR cameras will have, see now I am having a camera and multiple lenses. These lenses can be attached, detached, whatever lens is your preference, you can add in a DSLR. But what about a point and shoot and what about a mobile? You cannot do these things in a point and shoot camera or in a mobile. You cannot add and detach different kinds of lenses. Nowadays, mobiles are having some macro lenses attachments, but the problem is they are having suppose we are publishing some research paper and we are having a case report in it. Hello.
Hello. Yes,
Yeah,
sir.
there was some disturbance in the network issue, I guess. Start again. So there were two different kinds of cameras. Amongst them, we have a SLR and DSLR, single lens reflex, as the full form is. We have a category of different kinds of lenses which can be attached to this kind of DSLR. But what about point and shoots and mobiles? We are not able to do such things. So we have evolution of different kinds of lenses. Now, whatever images I am showing, these are my preferences to be used with Nikon, with Canon, or a third-party lens. Third-party lens means different manufacturing companies are providing this along with and as an attachment to the DSLR cameras. No, so now whatever I'm going to talk is an attachment of the lens or the cameras are the DSLR ones. At the end, I tell you what are the differences between a mobile dental photography and DSLR dental photography. Amongst them, whatever I'm sharing now, Nikon has a dedicated macro lens as 105 mm. We have Canon as 100 mm. We have the third party lenses as 90, 85. What does this mm? No, but the basic is sure to the later side. Now, this slide tells us about the triad which we need to learn first whenever we are please you can see the screen here. In front of me, I'm having a lens, and you can see a white spot in between. That is the lens opening. Can you see the screen? Hello.
Hello.
You can see the screen. After this, because there are some network issues here.
No problem, sir.
Hello.
Take your time.
Are you
Yes,
able to?
sir.
Are you able to see the screen?
Yes, sir.
Yeah. So we have something called as a lens aperture. Aperture is the opening. Can you see a white dot in between the lens? Now that lens is that shows the amount of aperture which has been allowed by me for the light to enter through this. Now everything is like based on the light itself. Now whatever I have told is this. Now you can see as I switch on. Can you see the aperture to increase and decrease? Okay. So as the number, can you see the number as f starting from 1 to f32? We have different lens aperture openings. If I say it is 1, so it is the maximum amount of opening which is given by the lens. Now different lenses have different kinds of aperture. Now this lens which I am holding is 85 mm 1.8. So what does 1.8 means? 1.8 is the aperture which is the maximum aperture provided by lens. Now this is 1.8. 1.8. As I go increasing the aperture size, the f number goes on increasing as f32 will be the maximum. So it is depending on type of lens. Now this is important because I need to play with the light. How much light has allowed by me decide to give a perfect image which I need. Okay. The second one is the exposure. Second term is the shutter speed. The shutter speed means when I hit the shutter button here, next shutter button here, the image is first there's an image. See, it just opens the So I was there at the exposure of the shutter speed, a fraction of second for which I click and the shutter button opens and closes to capture an image. Determines the exposure. Now this is, can you see? As I can change with that in a DSLR camera, not possible with some basic mobile cameras or point and shoots. But there are now very high-end mobile cameras which will be be helpful for changing of the exposures. But for the lens opening, only the thing of lens opening is not possible in any kind of point and shoot or mobile. So that is a big difference. Not play with the amount of light opening, light which should be entering inside the aperture. Now third one is the light sensitivity. Now I am having a sensor inside. Okay, for DSLR I am having a sensor inside. Once I click, the mirror opens and the sensor is being reflected, been exposed to the light which has been incorporated in the click. Now that sensitivity ranges from 100 to a maximum of 2,256. Now we have light sensitivity to be a very important factor whenever the sensors are being exposed to light. Now, for a macro photography or a dental photography, which is part of the macro photography, we need to have what does this three thing incorporate to give a perfect exposure. Now, what does perfect exposure in macro photography means? I need to have details of every aspect of whatever I'm clicking. So, if the light is proper and the lens is good, camera can be a basic camera itself. So it doesn't matter. But if I'm having a light which is being exposed properly through a proper aperture and having, I will get a good image. So all these three parameters have to be taken care whenever I am going for a photograph. Now, can you see the images here? We have f2.8 where means I have told that the lens is being opened more. So we have more light. So the image just below it, you can see we have a narrow. What does narrow means? Narrow means it is having a field of narrow vision. Means I can just visualize a very narrow field as compared to f11 where the aperture size is very small. So the light entering is very small, but I can get more amount of details of the car. Can you see the image here? We have two different images where I am just focusing a bit on the central portion of the car, but as I increase, I'll get the whole car to be in detail. So I will require details more in macro photo. So my f number will be at a higher range. I'm not telling f11, but it will be at a higher range. So I will have something called as a wide kind of field of vision. So my f number will be at a higher ranges whenever I'm using a DSLR. Now, second one was exposure. Exposure means how much kind of light, how much time the shutter should be open so that we can catch the light itself. Now, many cameras have some limitations in the form of they cannot go for higher ranges of f-stop, but depends on the camera version. If you're having a basic camera version, 1/200 of a second is the basic which is being used majority of the times whenever we are dealing with macro photography. So my f number was going to increase from the ranges of f11 and above. But for the exposure and the light sensitivity, both of these parameters will be fixed. So I will not change this whenever I am going for a macro photography. Majority of the times, I'm not telling every time, but we can play off with these things. But majority of the times we calculate exposures with the shutter speed of 1/200 of a second, or some basic cameras have 1/250 of a second. That is the amount of shutter opening and closing time, and the light sensitivity. So now light sensitivity, I do not play with light because I am having some light. I will use lights. So I'm already having ample amount of light. So my sensitivity of the sensor towards light should be very low. So I am going to play around with the light sensitivity to be as 100 to 200. So I cannot increase. If I increase, I will get more light. Definitely I'll get high sensitivity towards light, but I don't need that because already I'm using extra lights. So whenever you are practicing in dental photography, you're supposed to, because you are in ambient light, because whenever the patient sits in the chair or whenever the patient, whenever we are having some lights above itself, above the patient, that can hamper the image. So I just want to control everything so that the image is every time which I am clicking, every time I will get the same image with the same exposure cycle. So I need to create that cycle whenever I am going to go for dental photography. So I'll go back again. I was about for the lenses where I am having a Nikon lens as 100 mm. What 100 mm is? 100 mm is the focal length distance of the lens or the focal length of the lens. Now this is determining because if I am having a shorter focal length of suppose 25 mm, suppose if I am having a shorter focal length of 25 mm, I need to go more close toward a person, which is not possible. That's why a range of 85 mm to 105 or 110 mm is considered to be the range of focal length to be apt for a person who is carrying out a macro dental photography. Means I am having ample amount of distance in between the patient and myself to click. Okay, so that's why different third-party lenses have created different kinds of lenses, macro lenses from ranging from 85 mm to 105 mm. So Nikon is having 105, Canon is having 100 mm. Now they are having additional of f2.8. Now what I have told just previous slide, I have told that it is just the amount of aperture which the lens can allow. So we need to standardize that also. That's why we have a range of f1 2.8 to be considered as the apt for amount of light that should be entering for the particular image. So I have told you that f2.8 will give me a very narrow field. I don't want that. I will have a image to be having the f number to be higher. So I will go for those lenses which are macro, but which can provide us a very good amount of light also, and which can go to maximum reduction in the f size or f number. So all these three, or means Nikon 105 mm, we have a Canon 100 mm. Now I am having myself with a Tamron lens. This is a third party lens which is having a shutter. So can you see the lens? It just opens and closes. Now the disadvantage of this lens is that this barrel, when I go towards the 1:1 ratio, now as I go towards and open the lens, it is going towards 1:1 ratio. When I am talking of 1:1 ratio means the image which has been there, I am supposed to capture the same size image will be there on the sensor whenever I am clicking. So if I go towards 1:1, now this size of the lens has increased. So this is the disadvantage, because I have lost the distance in between how much I was supposed to be with 105 mm. So Nikon dedicated lenses are there. These lenses are again macro lenses which will not open and close like this. Standardized lens with the particular Nikon camera. All these cameras these lenses are compatible with their own companies, as Nikon is compatible with Nikon cameras, Canon is compatible with Canon cameras, but the third party lenses are there for both. So, and they are cheap. So I'll come on with the lenses cost. Lenses cost for Nikon ranges from 55 to 65,000 rupees. Again, Canon is costing around 35 to 45,000, and the third-party lenses start from 20 to 25,000 rupees. So that's why they're cheaper, but they are having the same capability as 1:1 ratio. But some disadvantages are they cannot be relied more upon. So Nikon will prefer a Nikon camera, Nikon lens. Now, next is I was talking about different types of lights. So why light is important? Because my first priority is I should be able to play with the light. Because my first point in my slide was for lights. Then came the lenses. So I have explained the lenses. Now we have different kinds of lights available. Now, why we need lights? Lights are important because I need to standardize the light which is going to enter my lens and whichever is needed for me. So I have explained the exposure cycle. In that cycle, I have told about the F number which is in the lens. Then I have told about the shutter speed and the ISO or the light sensitivity. In that, these two things are being controlled by the amount of light which we are going to give. Now, we have different light systems. One is called as, sorry for that, one is called as the light which is available with the lens or with the camera. This is called as the pop-up flash. Can you see the third point? We have the detailing of the pop-up flash. Now, why pop-up flash? This flash is available with the macro, with the normal DSLRs also, with the normal point and shoots. We have it with the mobiles also. But the problem is the control of the light from this pop-up flash is not proper. Proper in the sense they are very harsh. So we don't want harsh lights to be falling on the objects. Now, why we need this light to be very soft? I will tell you a fact, because once the light is spreading evenly on a surface, if the light is falling harshly on one particular point, it will give a white patch in that area, which is not advisable for a dental photography where we need details. So if the light is falling completely on the particular surface, we'll get more details. So that's why we have different kind of flash. Now this pop-up flash is not advisable for a dental photography. Then we have two more flashes remaining, three more. First is called as a speed light. Can you see this? This is a normal speed light. Now speed light is advisable for macro photography unless you are having something called as a diffuse with it. So now I'll just shift on to the next slide. What do you mean by diffuse? These are the flash accessories. Now flash accessories means there are something which has to be attached to the flash. Now why I'm doing this will create an environment where the light should be diffused very stably or very uniformly on the particular surface. I want the light that should be very much stable and very much uniform on the surface. So I need some details. So whenever I go for macro, I need some details. So that's why these diffusers have come. Can you see this first slide where the pop-up flash has been placed with a white colored sheet? Now there are different kinds of diffuser. You might have seen in very different kinds of photography shoots where the bridal shoots or during your marriages, you might have seen these kinds of umbrellas or things which are being attached to the particular lens, light. In that, they will click, the light will flash for a particular period of time and it will be very much uniform. That's why you get good glowing images. The image by lost. So we have something called as a pop-up flash diffuser. We have something called as a lambent diffuser. Now this is the lambent diffuser, which is having something called as a round shape. I will attach this kind of light, speed light, and I will attach to this area. Now whatever light will come, it will be diffused in a circular pattern. Can you see this circle? So once the light is diffused, it will be diffused through whole of the section and it will fall on the subject very uniformly. So majority of the times whenever we are having particular outdoor shoots, we prefer to have the lambent diffusers. Macro photography, we have speed lights. So speed lights will be attached to this kind of box diffusers, or we have studio lights. Studio lights will have definite, you might have visited many studios for your passport size photographs. So they will have some diffusers on both the sides. So they will have that light and they will ask you to sit at a particular place. So that will give a two-sided effect of light, which will be very much onto the particular person. Now, third and fourth, these are the two important things which have been very much practiced whenever it comes to dental photography. The third and fourth, I'll show you one part of it, something called as a ring. Can you see a ring? And this can be attached to the DSLR. See, all these parameters can never be utilized whenever you are having a point and shoot camera or a mobile. Mobiles nowadays have something called as a selfie ring. Yes, I'm having it. Just have to clip it on with the mobile so that you get a circular kind of light. This is all white, which is the light. It is having an LED inside. So once I start it on, the whole of the ring will be having some lights inside it, and this can illuminate the area. Now what I want a proper illumination at a particular area where I'm clicking. So whenever I'm talking about ring lights or ring flash systems, that flash system is majority of the times utilized for the posteriors, not for the anterior. So we have two sections, two areas where we need to work. So whenever I'm doing any kind of surgicals, whenever I'm doing any type of restorative material fillings for the posteriors, ring flashes are to be preferred because they have a very round surface and they cover that area where you are supposed to work in the posteriors, because posteriors we have a broad surface and we don't need to show any kinds of artistic work over there or line angles or point angles in that area. But when we talk about twin flash, which is this one, the twin flash system is very particular anterior where the line works are to be illuminated properly from both the sides. So this means as the photographer who is using for a passport size photograph, when we go to the studios, they are having two flashes on both the sides. Now, once the flash is clicked on, we can have diffusers on both this also. We are having different diffusers for both. So as I told, these diffusers, blocks diffusers, or can be used on both the flashes so that the light again is to diffuse. I am talking this because diffusion of light for me as a macro photographer, this is my own thing. It's never written, it's not written anywhere, but through so many of usage of different kinds of flash systems, I came to a conclusion that everything is about light and its diffusion. So whatever details are there are to be just because of what lights you are using, what lenses you are using, and what flash system is there. So diffusion of flash and its light along with a good quality of lens. Your camera doesn't matter because a basic camera will also do, but it should have some basic capabilities as a DSLR. Now, whenever it comes to digital dental photography, we need to have something called as retraction. Now, why this retraction is important? Because we need the light to pass to all the nooks and corners of the oral cavity. So whenever I am working, I should have an ability that I should get the light toward the same area where I am working. So that's why retraction for me again is the second most important thing apart from the what accessories I am having. Retraction is very important. Even if you are using a mobile, if the light doesn't go toward that area, then that area will be dark. So retraction is the most important thing for a particular dental photographer who is doing his photography. Now, why these cases and why I'm talking about this is cases and its recording is very much important nowadays, not just because of medical legal purposes, but because medical legal purposes were since ages. But the problem is nowadays we are facing issues where the patient is itself so much aware about a particular surgery or particular procedure that he himself finds out that yes sir, something is there missing. So as a dentist we can go back to the particular procedure. We can, if you have done a restorative purpose, if I have done a restorative case, in that if I'm finding a good restoration, I can click the photograph, I can see and analyze myself so that I can rectify whatever things are missing in that, so that you have become a good professional by yourself, not only just because of recording. So whenever I'm talking about retractors, market has ample amount of retractors. They're having U-shaped bridge, but for me, they should be independent. The patient should be able to put it, or the clinician should be able to put it inside the oral cavity, and the patient is allowed or the patient is asked to retract by himself, so that you have your own hands to be free at the time whenever you are recording. Now, few cases are there. I'll show one photograph. Can you see this image? You see a black background in a tooth. Now, whenever I'm taking a dental photography, I'm having something called as a contraster. Can you see this black thing? They are different shapes and sizes. So what does it do? Whenever I'm using or doing a particular case of the anterior restorations, as in this case, I can see a good image if there is a contraster behind it, because it will give a good contrast of the white and the black. If I'm having a tongue or the palate inside, I can see the palate also, so it will distract the image. In such case, I will allow the patient to hold, or the clinician can hold this contraster just behind the tooth, so that I can get a black background. This is just for aesthetics, can be skipped. This can be skipped, but retraction cannot be skipped. The most important thing is, whenever we are going for palatal aspects, lingual aspects, buccal side, lingual side, have different kinds of mirrors available of different sizes. I give you this size and sensitive that you make yours. Different companies for this. Amongst we have something as rhodium coated mirror. Rhodium coated mirror is the standardized one. Then less than that is for going for a stainless steel mirror, because these mirrors are very much sensitive towards scratches. So I should be very much gentle while using these mirrors, because once a scratch comes, the image, whenever I take the image as a mirror image, that time definitely there will be scratch seen on the photograph. So it is not good for that. For any type of recording. So whenever buying something, it should be good. So my suggestion will be a rhodium coated mirror. Second suggestion will be for a stainless steel mirror, and last one would be a normal mirror or plain mirror which we are getting through the market. Problem with that mirror is scratches are very common. Second, we have something called as a duplicate image or a ghost image along with it. So we have two images whenever we click. So that is not advisable. So we need to go for intraoral mirrors which are rhodium coated. Now, some terminologies which I have mentioned. I will go directly towards what images are being given by the IACD. Now we have different protocols. We have different societies which are asking for different types of photographs. Whenever we are giving the photos for publication or for recording purposes, so I'll share you to the group where the full face smiling profile, full smile, anterior retracted, right buccal, left buccal, maxillary occlusal, mandibular occlusal. So these kind of things are being there with the patient whenever the patient is being recorded for a case. Now I am telling you the second column. The second column is very important. Approximate magnification. So the first time when is not needed. Photograph taken 1:2 magnification. Hello.
Yes, sir.
There is so much of issues with the net here, I guess. Not able to be. Are you able to hear me?
Yes, sir. Yes, sir.
Yes, we can hear you.
Hello.
Yes,
Yes,
we can
sir.
hear you. You are audible.
Yeah. Yeah, fine. Sorry for the interruption. I was there with the full face profile where I was telling about the approximate magnification which is being needed as 1:10. So as I go for close to the tooth, if I want to click for a particular restorative, go to 1:1 magnification. As I go far away from the patient, means having something called as full face profile of the patient, that time I am a bit far away from the patient, so my magnification ratio will not be 1:1, because if I'm going for 1:1, I cannot take from that much of distance. So that distance matter, the approximate magnification I have told for the aperture. Now see, can you see the changes in the aperture size from f.6 to 8 to f22 to 29? So I am having something called as increase in the f stop, which I have explained earlier on. Means the aperture size which was there for the full face profile will be larger as compared to mandibular occlusal or a central incisor or a particular single tooth. F stop will be, means the aperture. I need to just play with the f stop whenever I am dealing with a DSLR. So my things are fixed. First thing is fixed, which is called as the shutter speed. It's always been fixed as 1:200. Majority of the times I use 1:1/60 or 1:200. It is fixed. The thing which is the ISO has to be 200 to 200 max, and the changes are there in the aperture, which cannot be done in a point and shoot or a mobile camera. Mobile cameras don't have this kind of provisions where you are going to deal with the aperture. So that is the biggest disadvantage, where I can have much more of details. So my details will be lost whenever I am having a mobile to be used. I was having these two kinds of lenses, which are called as the clip-on lenses, or these are used for the mobile photography. I'm having good photographs with this. The problem is I am not having that much of details whenever I'm comparing them with DSLRs. So better to invest one time, but that investment should be going on for lifetime. So rather than changing your mobiles daily, we are supposed to change your mobiles, but the problem is DSLRs have been brought. I don't advise you to have a very hi-fi DSLR, but I would suggest you to have just a limited or a basic DSLR, but you go ahead with good lenses and good light systems. Now the next point is for the point of focus. Where I need to focus, I have mentioned those points. These points, whenever I am talking about focus, it doesn't mean that when I see the center and I see the eyes. No, that is not the thing. I'll show you a photograph. Can you see this? How to click a frame? My shutter will be seen in the center of the star. Whenever I see this image, it will be the center. But when my lock is there, can you see the lateral incisor? I'm having a focus lock on that particular aspect. Why? Tell you why. Because if I don't lock my focus here, my focus will be it will be lost on the posterior aspect. If I lock my focus here, everything behind it will be blurred with the same f-stop. So what f-stop is? If I increase the f-stop, means f number to f32, 29, like that, it will cover the whole of the area, that too with good details. If I am having a f number of f2, it will be focused as compared to the whole. So if I want the whole of the image, I will have f number to be at a higher end. So that's why I have told you to go through this chart. Okay, so I have told about reflected image. The cheek retractors have to be used or not. So why we need an ideal equipment? So for me, ideal equipment I've told earlier, I'll just brief you about those cameras. Nowadays, Nikon 3300 was my favorite one, but the basic camera now has changed and this has been discontinued. Now it has been Nikon D3400 and Canon has a 1300D. Now these two cameras are the basic cameras which are being priced very low. and they can be used definitely for macro photography. Whether it be dental photography or macro photography, it can be used very good. So I advise you to buy these things, and I have told you about the lenses and the flash systems. Now you see both of the images. Just the difference I will tell you. What is the difference in between a ring and a twin flash is that when you see the harsh light as a ring over the particular tooth. But when I go for a twin flash with diffuser, you can see the line angles very easily. You see, so whenever I'm talking about a restorative restorative patient or a particular implant patient in the anterior area, if I want to have to show the audience or to show the patient what work has been done, this image will be far more better than the above image, because it is having a harsh light, circular impact, so that I don't need these things. I need something which is to be subtle and with diffusion of good light. So whenever I'm talking about twin flash, this is good and the best thing to be bought whenever you are practicing dental photography. Now, one thing is that, can you see something called as the lens? Now, I'm having a lens here attached. Okay, so I'll have a lens here attached. So whenever the lens is attached, it is having this line to be seen. But when I see, I'm having a viewfinder over here. This is called as the viewfinder, where I can see, and whenever I see, I will see through this plane. So there is a difference in between the planes whenever I'm talking about clicking an image. So this difference is called as the parallax error. Now this is why I'm telling you, because when I see and what I see, what the lens captures is something at two different planes. So we need to compensate for this. How to compensate? We cannot change the camera. Okay. So we need to check the focus where I'm going to shift. So whenever I'm seeing an image through the viewfinder, this means that the image is going to be definitely somewhat lower or 10 to 15 degrees lower as compared to what the lens is capturing. So I need to take care whenever I'm framing the image. So this is something which I add every time, so which cannot be corrected. So which can be seen only just now. Just I have told about the photographer who is photographing us for the passport size photographs. This is not just a passport. We can utilize this twin points lighting system. This is the same as I have shown in the twin flash system, where they have used two flash systems directly at an angle of 45 degrees towards the object which has to be photographed. Now, as earlier explained, mobiles versus DSLRs, there is no such comparison only. There are two different things, but the possibility of mobiles nowadays, it is very handy and it can be utilized for good photographs, no doubt in that. But we don't have range of depth of field, which I have told as the f-stop number, which cannot be changed for a mobile, but can be changed in a DSLR. So I can get good amount of details out of the image whenever I am going to click. So that's why f number is fixed for the mobiles. So I cannot play around with it. So everything is dependent on the type of lens aperture which has been opened. So I need to check for those mobiles will offer this kind of f number to be a variable. So there are very less mobiles, but they are having a f number of f 2.8 to 3.4 max. So we don't have f11, f22 like that. So we have to stick on with DSLRs. I am not against anyone who is doing mobile photography. I myself do it, but I am telling you what are the advantages of having a DSLR. Now, the most important thing, whenever I shift from a dental photograph, take the photograph to a lab. So I need to match the shades. So if I am going to perform a restorative procedure, suppose on this tooth, I need to show a particular color to the lab technician so that he matches this tooth color with the same. So for that use, we have something called as a gray card. What does this gray card? Nowadays, means since ages that nothing is white. So if I talk that this is white, and suppose this is also white, I am telling that the gray is the new white. So it was declared as gray is the new white for photographs only, not for other ones. Now, if I am having something called as a gray card. Now, gray card is the particular card where the color is supposed to be neutral. Now, whenever I take a photograph, if I am planning everything, my f-stop number is planned, my ISO and the shutter speed is planned, everything is planned. And when I click a photograph, okay, fine. Now I am telling that, yeah, the exposure is very good. I'm telling that. But the problem is every ambience means, suppose if I'm clicking in the inside a room, if I'm clicking outside outdoors, so there will be difference in the light which has been there surrounding me. So I need something to be very much standardized. So for that, for the labs, I will prefer to have a image guide by the use of a gray card, which is 18% of neutral gray color along with white inside it. Why I'm taking you this? Because this is having a good exposure triangle settings. Means a gray card will definitely be the most standardized card for us to transfer the color settings from one camera to the lab, where he will check the shade and guide accordingly to the according to the gray cycle. So I will have those gray cards to be used. So I will not go in details now. For just have a query, because those both of the images are being taken, same settings are not there, but the light is different, surrounding light is different. If I am telling you that this is good or this is good, which one among them? For me, this image was taken as the prior image, the first image. But the problem is, this is not what is the color of the ginger. As I see, when I see the patient intraorally by my eyes, I cannot see this shade. So what I did, I took a gray card and then I post-process it. Means I've done the processing of the image. Now that processing will take place in a software. But for that, we need a gray card to be hold just besides it, so that whenever I see that I have taken a gray card image, I will be able to adjust the color settings from this to this. Now change the color settings with the help of a gray card to this. Now this is supposed to be what is seen inside the oral cavity. So a big difference. It is all yellowish here. We have something called as melanin pigment scene. We have something called as the white halo scene. So we have a good image with good exposure post processing. So we need to process each and every image. That is why I have kept these two slides, because we need to learn processing, not only just because yeah, it's a good thing to learn, but no, it has got its own benefit, because we need to reproduce every image with the same quality. Because suppose if this patient comes on the first day and on the 10th day I need to take the same image, so I need to have the settings same, I need to have the post processing system same. So that's why I told you the particular aspect ratios also for 1:10, 1:2, 1:1. So where I've taken the image, I should have the whole of the criteria to be reproduced back after 10 days or 20 days or 1 month, whenever the patient comes for recall. Now this is just the magnification ratio which I was talking about. Can you see? The whole of the arch is seen. And now I have just focused on F number, which I have changed for magnification ratio. If F number is same for all, but the problem is the ratio of 1:1 is here, 1:5 is here, 1:10 is here. So as I go away from the patient, so I am having different parts of magnification ratio to be seen. Now, whenever I talk about dental photography, you need to have something called as consent. Now, the consent has to be taken whenever you are dealing with a dental photography person. Consent with the patient has to be signed by the patient, that he is having a consent, so that I can use it for dental records, dental research, any type of seminars which I have been taking for marketing. So for patient education itself. So for this, we need to have the patient consent to be given to us, so that the patient is not again going bringing us back to the medical legal purposes. So we need to have this. I can provide you this, because consent to a dental photography is not available online, so I will give you this. Now there are different things which have been tested for 3 or 4 photographs. Now you can see the differences. Now this pop flash which I was talking, not recommended at all. And you see the yellow color discrepancy. Now see the details of the image here. It's all harsh light which is being followed. Now we have a pop-up flash. I have used this pop-up flash with some diffuser. But the problem is again the details are lost. The something color changes are there. Now this is speed light, again harsh, not that much used, but without diffuser. See, can you see the yellow cast of the shadow? We cannot, we have details, but the problem is it is without diffusion of light. So some details are lost, some details are there. So speed light without diffuser is not advisable. Now, this is the twin light system, which I was talking about, twin flashes on both the sides. Now see, can you see the line angles? But some details are lost due to this flash coming inside the line angle. So details are up to number. So what to do? Twin lights, again, details are lost, don't have much details. We have used twin light with diffusion now. Can you see the details now? See the earlier image, and this is very flat. This was very flat image. Cannot see much of the details. Now I've used the diffusion. I have some added SDR there. So can you see? You can see different kinds of lines where the details are being visible. Now I will talk about mobile photography. See, this is not recommended because they are there definitely, but very much lost in details. This image has been taken by mobiles, but see again, if I compare it with a DSLR, definitely there will be a big loss in the details because the light system is same, but light which was used in this case was this self-fading light. So can you see the shadows here for the lights on both sides? That is not advisable. So we lost the details there. So we have some added advantage as a what I call it as a glamour photography. So we have polarized filters which can be attached. This is So again, sorry for the interruption because we having something called as tabletop photography. Again, related to different only. I have utilized different kinds of photography ideas where I've used the microscope to my benefit. So this has been taken from the Google. You should have an eye. You don't need fancy cameras as the persons are holding. Can you see this person? He's just waiting for the particular moment where I can take a particular image. So that is what an eye is about. So you can frame, you can imagine whatever feels good for you. And once in a time, so that we can have a particular moment to be with us. So photography not only is a good journey for me, but it's a good learning experience also. If you have any doubts, you can please email me and you can join me on Facebook. So I have been through Nikon photography school for several years. And I have delivered many lectures. Currently, I'm carrying out some hands-on practices to the dental clinicians. It's a good forte for me, but talking is again an art. So hope you all have got some knowledge about what dental photography is. If you have any doubts, I'm open to the house. Thank you for the patient listening. Hello.
Thank you so much, sir, for this very informative session. If anyone has any questions, you can ask.
Hello. Hello.
If anyone has any question, you can ask now.
Anybody is having any question here, please? It's open.
Hello. Hello.
Yes, sir, please ask.
Sir, I would like to ask that when dental surgeon takes photographs, he is in gloves. So how does he manage the infections control and photography? He cannot do photography at that time. So it is attendant or someone else who takes photographs during surgery. So how do we manage this?
You can type your query, sir, in the chat box also. I will be able to read through that. If anybody has a query, you can please. Hello, can you please share their question? Anyone?
Hello. Sir, the question was, if the doctor is in having gloves, so how can he able to capture the photos of that dental patient, or if there is any possibility of infections if he is not using any gloves?
Yeah, yes, definitely. All the protocols of for dental photography has to be carried out with strict aseptic conditions, because even if I'm using advice, or you can have a sterilized glove which can be covering this back portion of the, so that whenever you are touching it with any glove hand, it should be sterile. So whenever I'm having a photograph being taken, we need to definitely carry out strict sterilization protocols.
Okay, thank
I'm
you
not
for
into.
the answer, sir.
Yeah.
Thank you so much, all the participants, for your active participation. And last but not the least, thank you, Dr. Hiroj Bagde, sir, for taking out the time for session. With your permission, sir, I would like to end today's session here.
Thank you very much.
Thank you, sir.